Here are some hospital hints from an old postpartum nurse. Some things that you can bring or ask the nurses for while you're in the hospital. Bring a heating pad to the hospital. If you had a C-section, you may experience horrible shoulder and upper chest pain. Nobody tells you about this possible pain, and you may feel like you're having a heart attack. It is gas bubbles trapped under the skin from opening up your belly. I have found heat and gas meds are the only things that help. The nurses can give you these little heat packs, but they don't last long, so use a heating pad from home. You may not need it, but if you do, you will thank me. It is usually better in 24 to 48 hours, but during that time it can be very painful. Ask the nurse to make you an ice diaper if you have a sore bottom. Open a diaper and fill with ice and then close the diapers with the tabs. They work so much better than the ice packs they give you and last much longer. Also, if you have hemorrhoids, ask for some Tux and hemorrhoid cream to put on the hemorrhoids. Put right up against the skin. You can also put some ice in a glove and put that up against your bottom, and that will give you a lot of relief also. Ask for milk of magnesia the day after you deliver and take it in the morning and before you go to bed. They give you Colace pills, but they don't work as well. If you're bottle feeding your baby, tell your doctor if you have a family history of milk allergies or lactose intolerance, so you can watch the baby for allergies signs to the formula. The symptoms can include constipation, diarrhea, vomiting, distended stomach, blood in the stool, difficulty breathing, hives, crying, sleeplessness, and an unwillingness to eat. Wear a tight sports bra 24 hours a day to help with engorgement. Don't allow hot shower water to run over the breast as it may increase engorgement. Do not pump your breast thinking they will empty your breast and get rid of engorgement. It will only make it worse. Apply ice packs for 20 minutes at a time after you feed or pump. Use an anti-inflammatory medication like ibuprofen. You can drink some sage tea since it has properties in it that inhibit milk production. If you do not have an allergy to sulfa, use cold cabbage leaves. Wash the cabbage leaves and break the veins. Place the cabbage in your bra. Use an old one because it will stain it. Keep the cabbage on your breast for a couple of hours or until the cabbage is wilts. The cabbage can reduce swelling and inflammation. If your breasts become red and painful, or if you have flu-like symptoms and a temperature, call your doctor. If you're breastfeeding your baby, keep your baby skin to skin on your chest as much as possible and put your baby to breast often. Don't let the nurses give the babies bottles with large amounts of formula if you plan to continue to breastfeed. I would rather see them give a soothing pacifier to help calm the baby than a bottle. With some babies, their stomachs can stretch too much in the first few days, if also being bottle fed, which makes breastfeeding a lot harder. If your baby's blood sugar is low, then the baby should be given a bottle with 10% of the baby's weight in ounces. If you want to give the baby formula yourself, you can ask to do a finger feed with formula and only give about 10 cc's. The nurse can also set up a supplemental feeding system that can be taped to your breast near your nipple that gives your baby a little formula while nursing. Remember, the first 3 days of a baby's belly is very tiny. Think of the first 3 days as practice. Don't get frustrated or discouraged. It is not as easy as some people say in the beginning. If exclusively breastfeeding, infants should be given a vitamin D supplement, but be sure to discuss this with your doctor. You can start giving vitamin D when you and the baby get home. Send your baby to the nursery at night and get some rest. While you're in the hospital, you can have the nurses take the baby to the nursery from time to time, especially at night, so you can sleep for a few hours. You can then have them bring the baby back to you to be fed. Nurses might tell you that they can't take the baby to the nursery if you're breastfeeding. However, you really need to get some sleep, so be adamant. They will say that the baby needs to stay in your room so that you can learn his feeding cues. The nurse in the nursery can watch his cues and bring him to you when he needs to eat. You really need to sleep as well to get healthy and rested to care for your baby. Nurses really just don't want to keep bringing the baby back and forth for feedings. However, rest is essential for both you and your baby. Tips for discharge day. The day you take your new baby or babies home can be very stressful. They will try and rush you out of the hospital in the early morning to free up your bed. You do not have to rush out. Check with your insurance. Most say you don't have to leave before 10 p.m. Here are some tips to make your first day home better. Before you leave, make sure you send the baby to the nursery after a feeding so that you can take a nap. Then make sure you and your partner both eat a nice lunch, feed the baby, and take pain medicine right before you leave. Limit the amount of visitors that first day. Go home, relax, and enjoy your baby. Try to have help your first night home. You and your partner will both be exhausted and wondering how you are going to take care of this little human all night by yourself.